Good evening, everyone, and welcome to this discussion on HPV, cervical cancer. How can we prevent? What more can be done? What is the role of various stakeholders, especially in the context of India? I'm Dr. Ratna, and I'm here representing an international organization called the International Alliance of Patient Organizations, or IAPO, which is a global charity of over 300 member organizations across 72 countries, representing 52 plus disease areas. Our motto is nothing without us, nothing about us without us. So unless there is a patient voice in everything that we do, we feel that healthcare is incomplete. We know that the burden of cervical cancer is huge. There have been several reports around it. And I will start today's discussion with a quote from Dr. Tedros, the Director General of WHO. He says, and I quote, through cost-effective evidence-based interventions, including HPV vaccination of girls, screening and treatment of precancerous lesions, and improving access to diagnosis and treatment of invasive cancers, we can eliminate cervical cancer as a public health problem and make it a disease of the past. And I'd like us to dwell on this a little bit. Every life lost to cervical cancer could have been prevented, and prevention is so easy. However, there are many countries that are still lacking not only in the political will, but the infrastructure and the healthcare systems that are needed to eliminate cancer. In May 2018, the WHO Director General announced a global call for action to eliminate cancer, cervical cancer, underscoring renewed political will to make elimination a reality and calling for all stakeholders to unite behind this common goal. In August 2020, the World Health Assembly adopted the Global Strategy for Cervical Cancer Elimination. And this was meant to accelerate the elimination of cervical cancer as a public health problem in the next 10 years by 2030. Cervical cancer is a preventable disease. It is also curable if detected early and adequately treated. Yet it remains one of the most common cancers and causes of cancer-related death in women across the globe. The annual number of new cases of cervical cancer have been projected to increase from 570,000 to nearly 700,000 between 2018 and 2030, with the annual number of deaths projected to increase from nearly 300,000 to an addition of another 100,000, that's 400,000. More than 85% of these affected are young, undereducated women who live in the world's poorest countries. Many are also mothers of young children whose survival is subsequently truncated by the premature death of their mothers. Few diseases reflect global inequities as much as cancer of the cervix does. In low and middle income countries, its incidence is nearly twice as high and its death rates 3 times as high income countries. Proven cost-effective measures for eliminating cervical cancers exist, but to date have not been widely implemented in regions of the world where the disease burden is highest. To eliminate cervical cancer, all countries must reach and maintain an incidence rate of below 4 per 100,000 women. Achieving that goal rests on 3 key pillars and their corresponding targets. Vaccination, which is 90% of girls fully vaccinated with the HPV vaccine by the age of 15. Screening, which is 70% of women screened using a high performance test by the age of 35 and again by the age of 45. And treatment, which is 90% of women with pre-cancer treated and 90% of women with invasive cancer managed. With that background, it is my great pleasure to invite a stellar constellation of panelists, each an expert in their own specific area, to dwell on this great burden that's not only preventable, but as I just said, it can be managed very well even if there is cancer in the woman. However, it needs the right infrastructure, it needs a massive public health campaign and awareness, it needs investment, and it needs to invest confidence in vaccination, especially adult vaccination. It's my privilege to introduce the panelists today. Our first panelist is Professor Anil D. Cruz. He has a stellar biography, so I will just say it in few short words. He is currently the Director of Oncology at Apollo Hospitals and the ex-Director at Tata Memorial Hospital, Mumbai, India. He's been an oncologist for 30 years. And he has held leadership positions both nationally and internationally on board of directors, governing councils, executive committee of numerous hospitals, government organizations, cancer care organizations, and advocacy groups and professional studies bodies. He is current president of UICC for the 2020-2022 term. Our next panelist is no one else but Vandana Gupta, who is known for her advocacy work in her area of cancer. She is driven by the axiom, together we can and we will conquer cancer. She was inspired to set up We Care Foundation in 1994 after she successfully conquered cancer. She's a survivor herself. Based on her personal journey of managing cancer, Vandana was determined to fill the gap cancer patients and their caregivers feel as they battle the disease. She comes with a lived experience, and the lived experience tells the rest of the world what needs to be done. So we look forward to hearing from you, Vandana ji. Our third panelist today is Professor Nirmal Kumar Ganguly. I'm sure everybody knows him very well. I just saw his CV and I was bowled over because there are so many affiliations and so many boards that he sits on. I just wonder how he manages his time. But I will start with saying that he is a Padma Bhushan and was awarded by Her Excellency the President of India on 26 January 2008 in the field of medicine. That in itself says a lot about his achievements. He's also the former Director General of ICMR India. He sits on various bodies as presidents, as emeritus professor, as chairman of scientific bodies, on expert committees, you name it, and he is there. Professor Ganguly has been in the advisory board of Fogati NIH, National Vaccine Center NIH, Chairman Accelerated Elimination of Filariasis, Chairman High Level Advisory Committee to Ministry of Health on COVID-19, several other institutions and bodies of reputation. He has been conferred several prestigious awards, including 7 international and more than 100 national awards. Welcome, sir. The next panelist is Dr. Priya Agrawal, and she's the Global Head of HPV Vaccines at MSD. Welcome, ma'am. She's a Chief Behavioral Science Officer for Global Vaccines at Merck, and previously at MSD, she was a Managing Director for South Africa and Sub-Saharan Africa Cluster, and the Executive Director for Vaccines and Women's Health in the UK, where she worked with the UK government to expand immunization programs. She's a trained obstetrician and gynecologist in the NHS UK and received her degrees in medicine from the University of Cambridge and University of Oxford. She is also a PhD from the London School of Hygiene and Tropical Medicine, centered around development and evaluation of WHO Safe Childbirth Checklist. Welcome, Dr. Agrawal. And last but not the least, we have Dr. Alpesh Gandhi, who is the immediate past president of FOXI. Welcome, sir. He's also the chairman of the Practical Obstetric Committee, FOXI, from 2009 to 2011. He's a National Coordinator Emergency Obstetric Care, or EMOC, as we call it in short. He's a resource person for several books and guidelines and also established the OICU for the Government of India. His book on principles of critical care in obstetrics is available in more than 5,000 world-renowned medical libraries. So welcome, sir, and we look forward to hearing from you. As I said before, cervical cancer is something that can be easily eliminated. However, very little has been done around it to be able to actually achieve that target. I would like to call upon our first panelist, Dr. Cruz, Dr. Anil D. Cruz, to talk to us about what he thinks should be done to eliminate this and how do we address it in a country as large as India. Over to you, sir.
Good evening, everybody. Thank you, Ratna ji, IAPO, MSD, for giving me the opportunity to be part of this great meeting, along with some great luminaries who are sharing the stage. And I look forward to contributing on a very, very important topic. Particularly, it's not only a global problem, but particularly in our country as well. I wear two hats. I'm an oncologist. I treat, I research, and teach on cancer. Head and neck is the major area of my interest. But I now am also the president of the UICC, which is the largest NGO. 172 countries are members of the UICC, and advocacy, particularly the battle against cervical cancer, is one of the flagship programs that we pursue at the UICC. Just quickly to tell you, this was established in 1933. We have more than 1,200 global member organizations across 172 countries, formal relationship with a number of UN agencies. WHO is something that we deal with practically on a daily basis. And our mission statement is to unite and support the cancer community to reduce the global burden of cancer, to promote greater equity, and to ensure that cancer control continues to be in the World Health and Developmental agenda. Ratna has already set the stage about cervical cancer, that it's preventable and it's also treatable if diagnosed early. But the unfortunate thing is that it continues to be one of the major cancers globally. It's the fourth common cause of cancer. There's a life lost every 2 minutes because of this disease. Unfortunately, 90% of these cancers, as you can see the World Globocan map, are in the low and middle income countries. And there's gross inequities in the treatment, not only between countries, but also within countries. And in our country, if you look at rural India, you would have cervical cancer as number one. But when you look at the entire country and urban India, breast cancer is now number one. So even within countries, we have these inequities. And again, as Ratna said, the WHO Director General called us to action on the 21st of May 2018. A number of organizations have come together in this fight towards cervical cancer. And just to paraphrase a quote from the Director General, we have the tools to prevent, detect early, and cure this disease. And I'm calling for a coordinated effort to confine cervical cancer to the history books. So here really is the WHO life course approach to cervical cancer. This is the population prevalence according to the age, and WHO aims at primary prevention, secondary prevention, as well as tertiary prevention, with global guidelines, global indicators, and global cost effectiveness recommendations, looking at equity, that means affordable to all, integration into other healthcare systems, and giving our patients quality of care. Ratna did say the 90-70-90 approach to achieve by 2030 a 30% reduction in mortality. I put it up in a slide. The aim is to get cancer, cervical cancer, into what we call rare diseases, less than 4 cases per 100,000 women. To do this, you have to vaccinate 90% of young girls by the age of 15. We have to screen 70% of women between 35 and 45. And 90% of women who are diagnosed with cervical disease in the precancerous or early invasive cancers need to be treated to get this cancer into the history book. So it's called a 90-70-90 approach. Now, when you look at this conceptual framework, many people get swayed and think that it's only about vaccination. Now, if we continued our current vaccination and screening policy, this is how cancer projections would be for cervical cancer for per 100,000 cases. Now, if you only do intensive vaccination, this is how the incidence is going to fall. We're going to take up to 2120 to come and conquer this disease. But if you have the dual approach of vaccination and screening, and this is a very, very nice article, and I've given the reference at the bottom from Lancet, you can see that our success story will come by, it start to be seen by 2030 when we'll have a 30% reduction in mortality. And just to put this in terms of figures to drive the magnitude home, if we scale up vaccination, screening, and treatment according to the WHO targets of 90, 70, 90, and we look at 78 low and middle income countries, we'll have a 34% drop in mortality by 2030, a 69% drop by 2045, and probably a 90% at the at the turn of the century. Translated into lives saved, it would be 15 million lives saved by 2030. 74 million cervical cancer cases would be averted and 62 million deaths. Now, where do we stand today? WHO has given us a cue to go for it and aim for 2030, but really we are not on target to achieve 90% of the WHO target. As of June 2020, only 107 of the 194 WHO member states have introduced HPV vaccination. Our country is not on a universal vaccination for HPV, and there are many reasons we'll discuss in the panel and maybe in 1, 2 slides. America and Europe, not surprisingly, have the most introductions, 85 and 77%. Uh, Now it's important for you to note the next bullet that I have put. Low and middle income countries perform better compared to high income countries for the first dose. But then to get the last dose, they have a higher dropout rate. So if you look at the West, it's 67% for the first dose, 53% for the final dose. But if you look at low and middle income countries, they score higher in the first dose, but only five, that is 6% of countries achieve the final dose more than 90%. 22 countries, that's 21%, achieved coverage of 75% or higher, and only 35 countries, that's 40%, had a dose coverage which was less than 50. So you can see we are good to initiate, we are not good to sustain. And I think that's something that needs to be addressed for us to achieve the 90% target of vaccinating 90 women. Now, why do we have these barriers to widespread coverage? While HPV vaccine coverage is increasing, only 15% of girls worldwide are fully protected. 70% of the target population that needs this vaccination live in countries that do not have an HP vaccination program. And the uptake in low and middle income countries is complex, it's multifactorial. We have high programmatic costs, there are complex delivery strategies, supply shortages, vaccine hesitancy, even among medical leaders, and most recently, the COVID-19 pandemic upsetting a lot of vaccine campaigns and other cancer related services. And we can discuss this in more detail on the panel. Let's look at specifics to India, and these are my last 1, 2 slides. WHO has released a new guideline for screening and treatment of cervical precancer, and I've put the link up for those who are interested to follow it. But one of the strong recommendations here is that countries move away from VIA testing because of issues with sensitivity and quality assurance to HPV DNA testing. I know we have limitations in our country, but we keep selling the VIA story, and here you have a global body which advocates the HPV DNA testing. So I think we need to do both in tandem and slowly. Of course, VIA, there is some minor work from the country showing it saves lives, but that's if you do nothing. But I think the time has come to offer HPV DNA testing to those that can afford it. And then we have a lot of barriers from many of the medical leadership towards the HPV vaccination. In fact, the Tata Memorial Hospital had a view when I was there that they would not endorse HPV vaccine, and that's kind of implicated across the country. But now I'm happy that there are a number of groups who have taken independent charge and are now focusing on HPV vaccine to save the lives of women in our country. Now, this is going to be probably my last slide, last one, two slides, and I want you to focus on this. The pink, and this is very stellar, shows you the high incidence. Here are all the countries that have a high incidence of cancer, and you'll see how these percentages change. If we do vaccination and 2 lifetime screens, this is the status as it is in 2020. Now watch the year changing on the left column, right on top, and you can see how the colors slowly change towards blue, which will tell us that we are going into the rare diseases. So you see, if we do vaccination and 2 lifetime screenings, we will eliminate this by 2095 in the high density areas of the world. UICC is committed to cervical cancer elimination. We have multiple strategies. We are basically building global momentum among our members, rallying member state supports, and we are calling for national adoption and implementation by 2030. And there are a lot of toolkits that you can get on the website. So, in brief, these are my uh, 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 thoughts, and I'd be happy to take it forward in the panel. Thank you once again for the opportunity, and I hand back to the organizers.
Thank you, Dr. De Cruz. Fantastic messages from you. One of the messages that really caught my attention is we as a country are good to initiate, not good to sustain. And also barriers of leadership to HPV vaccine. That says a lot about the work that we have laid out in front of us. Also, as a country, we are not on the universal vaccination status. I mean, HPV is still not included in our public health policy, and our screening methodologies need an upgradation. So that actually leads me to our second panelist very beautifully. And I would like to invite Dr. N.K. Ganguly, who is the former Director General of ICMR, to talk about the public policy in advancing HPV vaccinations. And so we have seen that our hesitancy to adult vaccination has been removed by the COVID-19 vaccination that has now picked up great speed in the country. There was a lot of hesitation to all kinds of adult vaccinations, including pneumococcal for senior citizens, etc. But now that hesitancy is slowly moving out. So is it time now for the country to move towards vaccination for HPV being included into the universal vaccination? And how do we instill confidence in people to be able to take this up?
Thank you, Dr. Ratna Devi. Thank you, the organizers. Actually, after the stage is set, I had to really realign what I will talk. So this, and I think those who will follow me will have the same difficulty. But in any case, let me go forward. Vaccine hesitancy, which you said that India has lost vaccine hesitancy, that's not true. people got COVID fear, and that put meant lot of them forward. HPV infection is still considered in India as a sexually transmitted disease, and vaccination to sexually transmitted disease is a very big challenge. Secondly, at this given moment, Punjab, Tamil Nadu, etc., have formed the policy of delivering the vaccine. Punjab, particularly with Bini Mahajan, when she was at the helm, but only for the girls, not for the boys. So that's again a very big challenge. So the message should be that HPV only doesn't cause cervical cancer. It can cause anal cancer. It is now associated with head and neck cancer. It is associated with sinus cancers. It is associated with large number of other cancers. So that particular message should go, and the association are some of the genotypes are same. So if you take vaccine, and vaccine cross reacts with the each other. So although we say we have 16, 18 and vaccine, or Merck vaccine of course has two more epitopes, and they say some of the major epitopes are missing, but all the data which are shown, there are a lot of cross reaction. So even if you take 16, 18, you might be protected with others, although hard data is not there. Cervical cancer need to go with several messages. One of the major messages that death to cervical cancer is India is unacceptable. 60% almost die who are diagnosed as cervical cancer. They are diagnosed very late at stage 3 and stage 4. So the communication will be a very important challenge. Appropriate communication and appropriate advocacy with the groups who actually can be believed. The groups who are ladies who are cancer survivors. They should form a group like like in thalassemia, hemophilia, etc. Make the life of government miserable. So ladies can make their life miserable. All the minister's wife, you give them a message that don't give them any food till they relent, and you will find some action. So we need to create a pressure group, and we need to really hone up. People don't understand our language. I have seen it when I was working with Musahars in Bihar. They didn't have house, they didn't have television, they didn't have telephone, they didn't read newspaper, and they didn't understand what you were saying. So ultimately, they died and or became poorer. So one of the things which I had done, that there was a Guanese music professor in Boston. I partnered with them and went to several areas, and we spread the message through music, street plays, flash mobs, and we could get through. So our we, if you really ask me, we don't have any communication strategy in place. That's a very bad thing, because then we do not have social and behavioral part with that. Our ladies are still married when they are girls. They are not. They have not become women. They don't have control on their reproductive life. They have to produce many children. The Hindu male will not get circumcised because he is Hindu. So although world over people are getting circumcised, the reproductive health is although we are promoting sanitary pads and others, but it is still a pipe dream for the rural Indians. And there is a people think it's a kind of a stigma. But I had some my maid and others, and they were very hesitant to even talk about it. They the teaching and about the sex and reproductive part in our school is non-existent. If my mother knew how much wrong messages on sex I had when I was in school, she will become very upset that why I was not given right messages. So these are very very important in battle with cervical cancer. If we could really put public health measures, which is seen in Maharashtra, particularly in urban and suburban Maharashtra, not so much in rural Maharashtra, that it started dropping without even vaccination. So, so this is something which is very, very important in the messaging and action. Then then what comes? Second part which comes is the diagnosis. Although acetate screening, acetate painting, and visualizing with the visualizers has become much better than colposcope, but when the PAP was the only thing with Usha Luthra and others introduced for early diagnosis, uh, investigation was launched on me that many ladies who were part of the study, they got cervical cancer. So they went to Bombay High Court and filed a petition, Delhi and Bombay High Court. And Dr. Watts was Justice Watts was put on the thing, and we said we have taken all, we have communicated, we have done everything, and it has saved life. But she said that no, you are guilty. You have not explained enough why they will not come every 6 months or 3 months for a follow up. So they didn't understand what you said. And so the confidence of even those who participate is not very good. So, so with this, now we have a tool much better than acetate scanning and others. There's a small capsule which is a colposcope, which Nirja Batla from the All India Institute has taught the Bangladeshi girls. So 8 to 10 class girl now can put it in, and it goes to the caregiver. The image goes to the caregiver, and caregiver can then advise. We have done a very big study in Aragonda as well as in several centers in Chennai, and this was done, and we could detect many cases who have never been detected early. Like Chinese, what they have done, they take this nitrogen cylinder, the cryo surgeries, they do it at the village level, because if it is if type 1 stage 1 cancer, if it is detected early, you could really save the life, and it could happen. So this colposcope, this insertable colposcope is now made by the Philips. And there are now non-invasive HPV tests. The Diagene was the only one which was available, and there were issues and problems and cost. So now there are tests in the urine, tests in the saliva. These are non-invasive. You could even know that whether the vaccine has worked or not worked. You could show whether vaccine has worked or not worked. You could find out population who may not receive a vaccine. Then I come to few of the last minutes. One is the policy. When I was DGISMR, that is almost now 20 years back, and I found that this was a very important, HPV vaccine was very important, because we tell people that have clean water, follow wash, they don't do it. I have been defeated in Kirtinagar slums of Delhi. I worked for three years, showed lot of videos, lot of films, and found only 30% accepted it at the later period. So, but vaccine can do that. Vaccination, if you could convince people, when De Cruz showed that 85% of Americans took vaccine, I was very surprised that Americans are anti-vaccine guys. Somewhere something must be. They're not even taking COVID vaccine. So, and there are several court cases which they have filed. So, vaccination was is one of the things to reach everyone. Uh, who are vulnerable. So I got partnered with my company, and without any strings attached, mind you, it was no string attached. No, I was not their consultant, didn't receive any perks or anything. But I wanted the vaccine free for some time and to take it forward. So I did. Prasad Rao was at that time in health secretary. We did about 14, 15 major meetings, and ultimately one there was a policy taken that we will do some. Although the DCGI has approved that, even then they said that we will perhaps see that what is the acceptability, how it could be delivered. After that, I retired. I had done the HPV vaccine trials and with our prepared and the others. And I had taken the legal fraternity, the activists, the scientists, which are the most difficult community in India. They don't believe in anything and they fight with each other with various theories, as well as the journalists, etc. So nobody attacked me. Even Pallav Bagla didn't attack me. And we could do the trials. But here I had told that create a group, and everybody forgot. And they went ahead and did it in a tribal area where 4 girls died, one jumping in the well, one insecticide, one 14 days back. And one of our agencies stopped all the trials. But I am like King Bruce, you hit me and put me down 8 or 9 times, I will rise up and fight. So what I did, or Merck company didn't fight. It capitulated because it had no appetite to fight because of many reasons. So Miss Agarwal is sitting here. She doesn't know all their stalwarts came repeatedly to me. I gave them information messages, but they didn't have any appetite to fight really. So then I was the chair of the I was also in the Tata Memorial Board, and as Anil says, that they had some reason to believe that vaccine is costly and take public health measures and win over it. So I became RCGB in the Trivandrum RCGB chair, and I partnered with Radha Pillai and did 6 center trial, and very successful trial. It was published in Lancet, and 1 dose trial was also 2 dose trial instead of 3 dose was also successfully carried out. And we went to Sikkim with one of the NGOs. The Bhutan had done it, and we then interacted. Dr. K.K. Talwar was advisor in Punjab with Winnie Mahajan, K.K. Talwar, and the political system. We could really do this there. And Mr. Padmanabhan was the public health man in Chennai, very, very enlightened, very good. And he pushed it, so it was accepted over there also. So, so the policies are very, very important. Even now, then we did one more thing. I also am associated with. I did do some of the advocacy communication things with the NGO known as Global Health Strategies. So we brought in about 7 African nations first ladies and did a meeting in India, and the message went. At that time the health secretary came and he was convinced, and the discussions again started in India. So the policy making, I go to my last comment because I am aware that we have only 5 minutes. You could talk so many things, but I go to Anna Flischer's uh, famous triangle. In the top part, you generate knowledge. After that, you manage the knowledge. Then you do the translation and create a product. But after that, it stops. It doesn't move an inch because at the bottom are the politicians who make decisions, who provide money. But in between, there are social and behavioral scientists. Even the Department of Science Technology doesn't recognize them as social and behave as scientists. These guys are the major pillar which will communicate with people, take the product to people, convince them, and create a voice, political voice. I don't know how many of you, none of you are very young, very old, have seen the comedy known as Lucy. Whatever Lucy wanted, she got. So whatever people want, they will get. If they want male child, they get male child killing the girl child. If they want a coronary artery bypass, even Kerala villages get coronary artery bypass facilities. So we need to create that voice, that demand within the people for vaccination, that will ultimately solve the problem. Thank you very much for this opportunity.
Thank you, sir. Great message. What people want, they will get, provided there is a voice that is demanding it. And of course, your message about appropriate communication and advocacy, and our country lacking in that specific area. You also talked about digital and how digital colposcopy could increase access to screening, and also using alternate methods of screening in rural areas, including task shifting, meaning it need not be a healthcare provider who is actually doing this. And this actually fits in beautifully with the two pillars that Dr. D. Cruz talked about, saying it's not just the vaccines that will decrease the burden, but appropriate screening, vaccination, and early treatment and diagnosis. That actually brings me to our next speaker, Ms. Vandana Gupta, who is the founder of We Care Foundation. And I said earlier in my introduction, she's a survivor herself. She represents the patient voice, and she has done stellar work on advocacy, raising the bar as far as access to treatment is concerned for various cancers. So over to you, ma'am, to talk to us about how do you think the patient voice can get together to bring all the effective things that we need to be able to drive the elimination and the early treatment and diagnosis. And Dr. Ganguly has very nicely said that unless there is a very large demand and the patient voice with a lived experience pushing and asking for this, it is going to take some time to change the scenario in the country. Over to you, ma'am.
Good evening, and thank you for this opportunity. And being in the company of people who know so much and who do so much, I don't know what my voice can carry.
Your voice is not audible, Vandana. Please speak louder.
Can you hear me?
Yes.
Now, yes.
So, being with all of you and all the efforts that you all are making, I don't know what I can do and say. But one thing that I want to really focus on is health literacy. Why are we not doing enough for educating people? Why it is important for them to know what is ovarian cancer, whether it can be detected in the pre-cancerous stages, and whether what is the best thing. Like Dr. Dikshit mentioned that there is a controversy between the vaccine and not be vaccinated. Now, I as a common person do not understand these things. Either you say that vaccination is important, or you tell me that vaccination is not important. So what do I do? You are only confusing me and nothing else. And so with the result, I feel let it be. When it happens, it happens. Otherwise, I'm not going to go in for it. So that is where the doctors and the people who are knowledgeable need to step in and also explain in very, very simple language on what should be done. Now, if we go age-wise, we know that young girls in our country, especially in our country, will not go in for checkups by the doctors, or even because of so many social stigmas and problems, that young girls will not go for a checkup. So if we can, maybe include the ASHA workers to in the villages to sort of, encourage the young girls to go in for their checkups and explain to them why it is important for all these checkups, and then start on the vaccination if that's the best thing. Then that is where we go in. As far as the old population is concerned, we cervix cancer affects a lot of old ladies because they've not been checked all through. They've just ignored everything, and then they come to a stage when they are all affected. So that's starting, if you're saying 35 years is the best time to start. when we should have enough information available at the doctor's clinic. We all go for our maternal checkups and all that. Why there's so much information on maternal health nowadays? We don't have people dying because of problems during pregnancies or because of other issues, because so much has been created. The same type of information can be shared at every clinic, which is for ladies who are going for pregnant checkup. If we can display information about cervix cancer, display information about the availability of the vaccines or the test, at what age it can be done, then, and it should be all very, very comprehensive information in very, very simple language, maybe just illustrations, because most of our people do not understand or read the language, and there are so many different languages, but any picture can be easily seen. So that is how we educate people, and then the fear goes away. Because if you're talking about it constantly or showing pictures constantly, then there's no fear. That's how you encourage people to go. Also, the education of male people. It's extremely important, because the male people are the ones who, like, do not want their women to go to a doctor, especially in the village areas. So that is what we need to tell them, that how important the woman is. Why do we consider the woman important only if she's running your house efficiently? If she falls ill, then the factor of finance and other things come in. And then you don't want to treat the woman, because she then becomes a liability. But if we can tell the person that the woman is the fulcrum of the house, she needs to be looked after to be able to make the family run properly, and that is the type of education we need to give. Also, we know that men who are, especially people living in the villages, the men come out to the town, and they leave their families behind, and then once they are in town, they have multiple sex partners, and when they go back, and that is how they infect the ladies who are at home. So, what is the training that we are giving to these men? What is the training that how are we empowering the women? Are we telling them that they can say that, they don't want to have sex with somebody who's had sex with multiple partners in the town? No. Those are the type of things, I think, which are really, really important. Then in the villages, most of our villages don't have uh, toilets. We don't, at least, where women can safely go. Forget the sanitary towels, forget everything else. But even if I don't have a toilet to go to, if I have to walk 100 miles or 50 miles to go to a toilet, how will I take care of my hygiene? How will I take care of what I need to do? So that is the important part, and that is what we need to have. And light, there are no lights. So in the night, what is happening? Ladies are not being able to look after themselves. We know of a lot of people and organizations who are making the sanitary towels and distributing it, and making a big hullabaloo about it, that sanitary towels can be distributed. But has anybody gone into the construction of those sanitary towels? All of those sanitary towels which are made need a panty to go with it. How many of our ladies in the village are wearing a panty? So they don't use it. It's a waste of effort and expenses from the point of view of the people who are making it and to whom it goes. So why is not somebody really saying that you can make the sanitary towel, but this is the type of pattern we need you to make it in? Why should it come out where the panty becomes a necessity? So these, nobody really looks into these factors. I feel that's my thought, that these factors are not considered. With the result, though you may want to do many things for women with ovarian cancer, we are not really doing what should be done to eliminate the disease or to cut down on the disease or to let women feel strong enough to take action on it. So, I think this is what I would really like to say. And if these 3 or 4 points can be taken care of, I think we'll have a large number of people who will be diagnosed early in the pre-cancerous stages. If diagnosed late, they will not have the fear, because the family will not feel that so much money is being spent on them, and the hygiene part of it that can be taken care of. Thank you.
Thank you, ma'am. You raised a very, very important issue about an enabling environment where women are empowered enough to be able to seek the healthcare that they deserve. Also, about the disparities that exist socially that prevent women from seeking healthcare. And that leads me very well into our next panelist, Dr. Gandhi. Sir, women are at risk for cervical cancer, and from the IARC report that I can see in front of me, the female population aged more than 15 years in India in the year 2018 stood at 469 million. And if we look at our first target, it says 90% of women screened. We also heard Dr. D. Cruz saying that we are not going to achieve these targets. We heard Professor Ganguly say that the boys should also be vaccinated. It is not just the girls, but the boys also should be vaccinated. There is a study that was conducted, very recently in Delhi, which said that it was published in the Indian Journal of Cancer, and it showed that 85% were aware of cervical cancer and were willing to undergo diagnosis by pap test. But as far as vaccination was concerned, 63% found that it is acceptable, but then they were very hesitant to take the vaccine. So in terms of knowledge, there is no dearth, people know. But when it comes to the actual shot, then there is hesitancy. So from your perspective, sir, how can we increase this uptake of vaccine, and what can be done to make this a gender neutral approach and say it's not meant just for women, but also young boys and girls, so that that fear that there's something that's going to happen to daughters if the vaccination is given is removed. Now, also, as Professor Ganguly said, there is a lot of hesitancy amongst women in general to come forward for health checkups. You have been the immediate past president of FOXY, and you have done some stellar work to increase awareness, especially around maternal and child health. How do you think organizations like FOXY can actually participate and increase awareness around vaccination and its uptake?
Thank you, Dr. Ratna Devi, and thank you, organizers, for giving me this opportunity. Uh, Almost all points which I want to discuss is nearly covered by previous esteemed faculties. So I would like to discuss briefly about what FOXY has done and for what FOXY can do, as Dr. Ratna Devi has asked. So I think in last 2-3 years, FOXY has taken this on priority, and we have conducted so many activities. I would say before the WHO call, we already started to work aggressively on this aspect. First of all, in 2018, we came out with a guideline about the all the aspect about the vaccination, screening, and management in Indian context, even including in the rural part of India. And it came out beautifully, which ministry has also appreciated. Uh, I'm happy to share with all of you that even in spite of COVID-19, last 2 years on International Women's Day, we organize mega cancer screening camps for cervical cancer and breast cancer across India, and we find our other alternatives how we can screen women during this COVID-19. And on single day, both the years, we have screened more than 60,000 women across India for cervical cancer. Uh, so it has created a great awareness, and how we can do this is because of, as just discussed, what I believe is whatever policy we make, whatever infrastructure we create, whatever facilities we create, but unless, as Dr. Ganguly sir has mentioned, we do not create the demand. If the receiver end, if they are not ready to receive the services, it will not be of much use. And that is why we have done lots of community connect programs. Last year, under my presidency, we have celebrated 23 national international day. Like International Women's Day, we have done a lot of community program for the cancer, women's cancer. So similarly, we have done adolescent on Youth Day. We had gone to the many colleges and schools online, and more than 1,00,000 boys and girls. We educated them for this vaccine and other preventable diseases. So I think community connect programs are very very important. We need to reach to them. We need to educate them. We need to sensitize them. And I think this is the best time, because during this COVID now everybody is are knowing the importance of their health, and they all are now knowing what is public health. I think we need to declare even cervical cancer as public health problem. And we also came out with the Fox's position statement and advocacy statement through our 250 societies. We hand over this statement to 250 health authorities across India, where we demanded many things, like to include HPV vaccination in government's program, in national immunization program, as well as in state immunization programs. We also recommended National Medical Council, newly formed NMC, to start a preventable gynec oncology clinic in all the medical college, mandatory to start these clinics, and to train postgraduate to postgraduate students at least for 1 month in this clinic, so that they can also learn and they can sensitize, train for this. We have done lots of TOTs, training of trainers. And one important thing is, as we all know, that northeast east states, 8 states are having the highest incidence of cervical cancer. And we have declared on 8th March 2021, we have started a 5 years program, 5 years project, pilot project, for making northeast states cervical cancer free. We have started, we have formed our group, we have find out referral centers, we have distributed posters, we have trained our 75 gynecologists as the trainers under TOT. So we are doing lots of activity in northeast states, and we are also going to form the registry for this. I think we need to, and we also going to train healthcare worker in northeast states. So I think with support of healthcare workers, from willingness of our patients, and from willingness of our doctors, I think we would be able to achieve our goal in northeast states. I think Fox's primary mission is to reduce maternal mortality and neonatal mortality and short-term and long-term morbidity. But this time we declared that now this is the time that with this we need to add other priority also, because in India, in many states, we have achieved good desirable maternal mortality rate. At least in 10 states, we can say it is near to achieve SDG goal. So we sent our message to all our 38,000 gynecologists, that and all the government and all the authorities where we are meeting, that now with maternal mortality 25,000 women are dying in India. So it is definitely our primary goal. They should not die, because 80 to 90% of them can be saved. But at the same time, 70,000 women are dying because of cervical cancer, and 70 to 80,000 women are dying because of breast cancer. So more women are now dying from cervical cancer than maternal mortality. So we need to add another priority to our primary goal. And we uh, communicate with all our 38,000 members that we are also not, if we are not gynec oncologist, then also we all are preventive gynec oncologist. And in our busy schedule, we should not miss our main role as preventive gynec oncologist. And I think all 38,000 gynecologists are convinced, and there is a great momentum about this cervical cancer across India in all 38,000 gynecologists. And some of the gynecologists also took pledge to screen certain number of women free in each month for cervical cancer. So I think Foxy is on the on the line with all other partners and all other organizations. And I think this is, thank you very much. This is something what we are doing at Fox 11. Thank you.
Thank you, Dr. Gandhi. Great message that you are adding other priorities, and that the fact that there are more deaths due to cancer than due to maternal, reasons, and therefore there is a need to shift focus and see how we can prevent these unnecessary deaths. Also, that the gynecologists and the obstetrician community can play a great role in early screening, and have maybe HPV screening as a routine part of any woman who presents to the gynecologist for any other reason. Also, your message on maybe we should declare this as a public health problem so that it receives greater attention than what it is receiving right now. Also, all the information that has gone in creating.
Can I say?
Yes, sir. Go
Yeah,
ahead.
I had a meeting with Dr. Vinod Paul, Niti Aayog, and on behalf of Foxy, we also recommended that every year International Women's Day should be now celebrated for cervical elimination of cervical cancer.
Yeah, so another great.
We need to designate one certain national or international day for this.
Certainly, I completely agree with you. We do have an International Day for breast cancer, and considering the burden of disease for cervical, maybe it needs to draw more attention. Also, the fact that you have created so much of awareness materials that could be used by other advocacy organizations and patient groups to be able to disseminate the message. Great messages from you, and that leads me very nicely to our next speaker, Dr. Priya Agrawal. Because we have covered almost all aspects of how we can prevent, diagnose early and treat the cancers. But through the awareness generation programs, through screening at the grassroots levels, by telling college students the risk factors and how they can prevent themselves from risky behaviors, etc. But the fact remains that unless there is vaccination, we will never achieve the goals that WHO has set for us. So, and there is a lot of vaccine hesitancy. There are myths and misconceptions against the safety of the vaccine. So we have Dr. Priya, who's going to talk us through the science and of the vaccination, and what kind of vaccines are there, which ones are the best, what do they prevent, and why is it important for countries like India to adopt the vaccination schedule. Over to you, Dr. Agrawal.
Very much, Dr. Ratna. First of all, good evening. I'm incredibly privileged to be with the speakers today. Both their passion and the work that has happened before in terms of protecting the health of people in India and beyond is actually very inspiring. I heard a clear call to action from the panelists, clear strategies on what we can do, all of us. So if you're in the audience, you and the people you know need to demand this vaccine, because of what Dr. De Cruz said in terms of the impact it could have. Healthcare providers in the audience. I heard someone say, Vandana, I think, please keep the message simple. You confuse us. Your voice is powerful and influential. If you are married to a decision maker or budget holder, do not feed them, said Dr. Ganguly, until they make the decision to protect the people of India from HPV preventable cancers. And please don't make this all about girls and women, as gender neutral vaccination will not only protect boys against other cancers, but also accelerate cervical cancer elimination because it reduces the amount of virus in the community as a whole. And I think the last panelist said, make cervical cancer elimination a public health and moral imperative for India. I'm not going to repeat why it's important for India. You heard that cervical cancer in India is a cancer of seconds. It's the second leading cause of female cancer in India and second most prevalent cancer among women 15 to 44. First, if you go into the villages, it's the second leading cause of cancer deaths in women. 27% of the global cervical cancer disease burden is in India. But the light at the end of the tunnel, I'm an optimist, is that India could be the first country with this level of burden of disease and the scale of population to achieve elimination. And as you heard from the previous panelists, it starts with the right commitment to vaccination, especially gender-neutral vaccination. So I just want to pause on what I just said there. Elimination of a cancer. There's only one disease in the world that has actually been effectively eradicated, and that is the infectious disease smallpox. There are some other infectious diseases that have been nearly eliminated. But now we have the opportunity, as WHO and Tedros have said, to eliminate a cancer. Why would India not want to be the leading edge of that? So why do I believe we can prevent cervical cancer with vaccination? MSD has been in this space committed for more than 20 years to help prevent HPV-related cancers and diseases with our 2 vaccines. We've literally distributed millions of doses around the world. And so I wanted to show 2 examples to make us realize that it is truly possible. So there was a recent New England Journal of Medicine article that came out. Cervical cancer, for the first time, as demonstrated in the Swedish program, they saw 88% reduction, 88% reduction in invasive cervical cancer among those that had received the 4-valent vaccine. Australia has realized a 93% reduction in HPV infections after just 9 years of a gender-neutral vaccination program, and will probably be the first country, unless India beats them to it, to achieve elimination. People have brought up hesitancy. I truly believe it's what the other panelists have been talking about. We've got to stop talking about sex and start talking about cancer. But you asked me to talk about safety. We have had more than 160 global studies talking about the safety of this vaccine, because we've had millions to billions of doses going out all over the world. WHO, US CDC, lots and lots of scientific organizations have repeatedly evaluated the safety of HPV vaccines and again reinforced the safety of this vaccine. I will not do justice to this audience if I only focus on cervical cancer. HPV causes more than cervical cancer, and it causes more than other female cancers. In India, we're seeing a rise of those other cancers. So in India, I think the incidence of overall HPV cancer burden is 1.7 lakh cases annually. We are seeing a massive rise in anogenital cancers in India in the last 10 years. So it's great that India is now going to start moving towards gender-neutral vaccination. Now, as I said, there are 2 vaccines. We have the 4-valent and we have the 9-valent. We've had the 4-valent in India. I think it's been licensed for more than 10 years. As others have shared, it's had limited use apart from in Punjab and Sikkim. And I have to say, I'm so proud of the results they achieved. Punjab, this is what happens when India commits. It does it. Punjab got 98% coverage of 2 doses. That's amazing if you look at the global data. Sikkim had 97% coverage for first dose. I can't even get those coverage levels in the US and UK and other countries that have been doing this for much longer. And so when I come to the importance of 9-valent for India, the first gender-neutral HPV vaccine in India, let me tell you why I think it's important. So the 9-valent compared to the 4-valent adds another 20% protection. That's global data, not India specific. So you go from 70% protection to 90%. Now you're really talking about elimination. But if you look at the types that are prominent in India, so let's just focus on India, it's not 90%. The 9-valent vaccine covers 98.3% of the types that cause cervical cancer. 98.3% coverage you'll get from the 9-valent in India compared to the 4-valent, and of course compared to the 2-valent. That's really powerful. So let me just close, because the panelists before me have shared everything you really need to know and what you need to do. With an estimated 600 million people below the age of 25, India has the largest youth population in the world, and is expected to have one of the youngest populations in the world till 2030. That is a massive rise in working age population between 15 to 64. And it could generate exponential increase in productivity and economic growth. Before the conference started, we were having a conversation. You know, I'm Indian, you know, and many of my cousins actually grew up in India. Why does our youth leave India and become a CEO in America? Right? We need to keep the people in India contributing to India's productivity and economic growth. These people are building future for themselves and the future of India, and they deserve protection against a preventable cancer. I really think we can make this a reality, and we can get India on the path to protecting more people. But let me finish with a quote. I used to be an obstetrician, and this guy was a mentor of mine, and I don't think it's very different to the issue of cervical cancer. Professor Mahmood Fatala, a past president of the International Federation of Obstetricians and Gynecologists, said, "Women are not dying of diseases that cannot be prevented. They are dying because societies have yet to make the decision that their lives are worth saving." And so, as one of 3 girls, I get very passionate about this. So my question to you and India is, are you ready to value women's lives and their health? Because if the answer is yes, as Vandana says, together we can, so let's do it. Dr. Devi, we can't hear you.
You are not audible, Dr. Ratna.
Yeah, am I audible now?
Yeah, now you are audible.
Thank you. I'm sorry for that. Great message, Dr. Priya Agrawal. I mean, together we can, and together we should. It's not just together we can, but together we should. And also that we are one of the youngest countries in the world, huge population below 40, not just 25, but below 40 as well. And these people deserve the protection that they require. They need an enabling environment for us to become an economic superpower. We are all hoping we will be, and that we don't have to go anywhere for our medical needs. We have a few questions from the audience, and if I'm permitted to, address these questions. The first one is for Professor Ganguly. And sir, the audience says that you highlighted that the hesitancy for COVID-19 was huge in the earlier stages. It still continues to be there. However, there has been a massive thrust by the government to increase the confidence. What are the lessons learned from COVID-19 vaccination that can be taken forward for HPV vaccination?
The COVID-19 vaccination actually set up the vaccine chain around the country, and the private sector hospitals were not participants in that. Many of the other centers, which are non-conventional schools and other places, so that particular chain has been set up. It should be enabler. Apart from the COVID, apart from the HPV vaccine, both Malaysia and because they wanted to introduce dengue vaccine, which is given to 9 plus and others. So they wanted the experience with HPV vaccine. Philippines, Malaysia, they wanted experience with HPV vaccine because the age group was similar. So they thought that when the dengue vaccine comes, they will be able to introduce it. The same way the COVID vaccination is now moving towards 12 to 16, this will be again a big enabler. One day I will also like the antenatal women to get screened and maybe vaccinated so that they protect their children. And that is also happening because antenatal women die when they get influenza or when they get COVID much more than others, and this has been approved now. So there are a lot of enablers which has happened, and these enabling mechanisms will do it. We need more vaccines, and this need to. There are 3 Indian companies who 2 of them have already with the DCGI, and one perhaps has just got permission. And there will be 3 Indian vaccines. The cost of the vaccine will be important. Some or other, Merck didn't oppose the 2 dose, and now the 1 dose trial is also on. If the 1 dose trial succeeds, the price will come up down, and the companies need to do their bit in just not pushing a brand but a vaccine. And very soon, when the India and Gates Foundation etc. also did promote this, that we should have Indian manufacturing vaccine. So when we have more vaccines in the field, there are many other therapeutic and other vaccines are also coming up. So people will have choices, and government should be able to take it in the program. I agree with Dr. Alpesh Gandhi that it should be put as a public health issue, and it should go into school vaccination program of India. And if it goes, it will be very good. But until unless government becomes a partner into this along with the communities, this is not going to happen. But I was really enlightened that how Foxy has moved into this. The mother and child cannot be separated, so Alpesh should also make the Academy Pediatrics a partner, and both of them should push it the way the Foxy has done. Congratulations, and very commendable.
Ratna, I just wanted to respond to a statement that Professor Ganguly made about putting it into school programs. We must be mindful of the fact that many people who are vulnerable in our society never go to schools. So I'd make a compelling case to have a hybrid model. It should not only be in school, you'll miss out. You just have to look at the school dropout rates between 8th and 12th, and you know if it's only in school, we'll be floundering at the end of a decade. So it should be a hybrid model in my book.
The vaccine should be given when they are getting the meal in the school.
Yeah,
So
but so many
with the meal, so they go, even they are drop out, they go to get the meal. That's where attraction.
Can
I don't know whether Dr. Ratna Devi disappeared.
Can I say something, Dr. Ratna Devi?
Yes, sir. Please go ahead.
Yeah. So, yes, I agree with both our two esteemed faculties. We cannot go alone to boys and girls in schools. We need to go to not only boys and girls, to teachers, to parents, to media. We have reached to we should reach to each and every corner of India. We should try to sensitize common people for its requirement, how it is useful. Here, I would definitely like to discuss about, as Ganguly sir has mentioned, regarding the COVID vaccine. As previously, pregnancy and breastfeeding women were not included in beneficiary list of COVID vaccine, and Foxy was first. I came out with the position statement, bold position statement, that we can give it and we should give it, and we recommended it to government. We advocated it to all the levels. We sent it to all the authorities, and immediately we received support from WHO India, then Indian Medical Association, Neonatology Forum of India, Indian Pediatric Associations, Indian Association of Fetal Medicine. So many other associations came forward to support Fox's advocacy statement, position statement regarding COVID vaccination for pregnancy and breastfeeding women. And with there was lots of discussion on electronic media, TV debates, as well as in on social media also. And then initially government has approved it for breastfeeding women and still not for pregnant women. And but still then we continue our advocacy to government, and in so many meetings with ministry. Even ministry were was also of opinion that now this is the time we should also release it for pregnant women, but there were certain compulsions like manufacturing companies have not approved, studies were not there, so many problems were there, but then ultimately we all jointly decided, and then Antagi has decided to also allow it for pregnant women. But this was because of all at all the level, we have worked at all the levels. So I think for cervical cancer also we need to work with all the partners at all the levels and should reach to each and every corner, each and every women, girl and boy, whomsoever are beneficiary. Then only this will be there will be a solid impact.
Alpesh, I want to respond and even to the comment again of Professor Ganguly about gender neutral vaccines. And I think I agree with you all. Australia is the only country heading there very, very soon. By 2028, they should have everybody. But we must understand that the vaccine is scarce. We have a very poor
Yeah.
program to save the life of our girls and our women. The priority goes to women first. Don't open up another front when we've not been able to stem one front. So gender neutral vaccination is a utopian idea that our country will be ready after a decade. You have to go women first. That's the priority. I'm mindful of the fact it causes other cancers, and that's the WHO stance as well. So there may be some people in policy listening to us who can influence government. If I was asked by the health minister, I would say first women. If you have
Yeah,
enough, give to all.
agree, Dr.
Quick comment
Anil.
on
Yeah.
both of
Why
those
should
things.
there be
Agree,
a
Dr.
law
Anil.
that men cannot be vaccinated? Why
Hanji,
should that law
why should
we have
the
a law? Why should men not be vaccinated? Let it be depending on the availability of the
Are
vaccine. But if you
Vandana, for argument's sake, everybody has to. You don't have enough. घर में 1 लीटर दूध होगी, पहले बच्चों को दोगे, आप नहीं पियोगे. बस
वो
यही.
सही है, पर आप रूल
Doctor,
नहीं बना सकते कि आज तो होगा ही नहीं.
ठीक है.
Doctor
That's the
Vandana.
point I'm making. This is the scientific forum. We are not going to get passionate. We are discussing science. We are discussing what the WHO stance is. There are many people listening to us. We all have our views. And I'm just making a scientific comment and sharing the WHO stance.
I
Dr.
can see.
Dr. Vandana, in
Yeah.
continuation of Dr. Anil, I would say in national immunization program or in state immunization program, it can be for girls and women, but it can be open for male if they wish to take on their own.
That's true.
That's
I
a
agree.
fair.
And Professor Ganguly has his hand raised.
Yeah, actually, I agree with everyone here that when you have a scarce commodity, you give it to the most vulnerable. And that is the girl child and woman. But the male in the STDs as well as the HIV, I have seen that the male participation is very, very important. If they actually, it is the males who give it to the women. So if the male do not participate symbolically, it will be a major problem. So we should ensure that males participate in this campaign very vigorously. And when we have enough, as I told you, that we will have enough. There are more manufacturers who are getting in, and they will be providing lot of doses over here. And then we should see. But in our campaign, we should make males as a also a participant. They should not stay aloof.
Ratna,
Thank
can
you,
I
sir.
just make a comment on
Yeah.
supply
Yes,
as it's yeah.
quick comment before I close. We are
Sure.
already over. Yeah.
So I just want to make a quick comment, and I'm sure we have some WHO colleagues on the call. The comment around lack of gender neutral was made because there used to be a supply issue that is going to be updated from 2017 to 2020. The supply has doubled and will be doubling again by 2023. So by 2023, we will, as a community of manufacturers, have the doses to meet what WHO is saying the global demand. So I would put a please, like Mandana and others are saying, make a commitment to gender neutral, because it will make the manufacturers make enough doses for India. If India says it's only for girls, we will make enough supply for only girls. So that would be my plea. We are coming out of a supply constraint.
Dr.
Thank you
Priya,
so
we cannot spare, we cannot ignore male, and male participation is very, very important. They should also be protected, and we need to educate them also. And we need to generate the demand, more and more demand to the manufacturing company. I think this is all very, very important, because only when resources are less for government, how to utilize government is a different thing. But definitely, male participation is very, very important, and we need to protect them also.
Thank you, sir. Thank you so much. We are just out of time. There are a couple more questions, but I'll share with the panelists or via email. And there are important questions, in fact, addressed to Dr. T. Cruz. So there is consensus that we need to work more on elimination of, or at least the early diagnosis, treatment, screening for cervical cancer. There is already great work being done by professional bodies like FOXI and the Indian Academy of Pediatrics. A lot of stellar work being done globally by organizations like UICC. But as Vandana ji mentioned, there needs to be an enabling environment, and a lot of work needs to be done to create that enabling environment. Dr. Agrawal, has convinced us that there will be no supply chain issues, and that there will be plenty as soon as there is a commitment. There is a public health commitment and a policy level commitment to be able to vaccinate people in the country. We are a young nation. We need to protect our young people and move forward as an economically strong country. We had lots of insights from Professor Ganguly, and I thank all of you for the wonderful thoughts that you shared with us. I only hope that we continue to work together on this very, very important issue, and I will stay connected with you. Thank you so much once again. Thank you for sparing nearly 90 minutes of your precious time. I know you're all very busy people. Thank you once
Thank you,
again.
Ratnaji. Thank you, everyone.
Thank you.
So thank
Nice to
you.
see all of you. Thank you.
Thank you, sir.
Bye.
Bye, sir.